on for about a year and a half without a diagnosis. I'm a physician, and I had a particular set of stairs that I had to climb to get to the operating room. Over that year and a half, it became progressively difficult until one point I got to the top, and I literally almost fell down, and I thought, this is not normal. And I'd already seen a cardiologist, and she had said that I had some problems with the right side of my heart. Finally, when I went back, she said, let's do another echocardiogram. It showed more thickening in the heart. So as soon as she saw that, and I think conferred with one of her colleagues, that's the first time I heard the word amyloidosis.
There are literally dozens of kinds of amyloidosis, but most of them are both exceedingly rare and don't tend to cause problems. The main forms of amyloidosis that we're focusing on are what are called systemic amyloidosis, meaning that it's an abnormal protein that's circulating in the bloodstream and that can then deposit in one or more organs.
This particular protein becomes more sticky to other proteins that are alike, and they stick together and float through your blood and just kind of get stuck in stuff. It's like sticking peanut butter inside the mesh of your heart. It just gets stiffer and stiffer and stiffer.
Dr. Anderson, like many patients, was diagnosed when the disease was quite advanced. He had advanced congestive heart failure and was unlikely to live past a few months.
My heart was in really bad shape. In the end, they determined that because the amyloidosis was mostly in my heart and not in other parts of my body, that I would qualify as a candidate for a heart transplant, which was wonderful news. And what I didn't know was that Dr. Watellis at Stanford was interested in amyloidosis. So we're just ready to get in the car and the phone rings. And I hear this voice, "Hi, I'm Dr. Ronald Watellis from Stanford." I felt in that moment an incredible peace that he was the right person for me. And he was going to, if possible, make it happen, that I could get a heart that would save my life here at Stanford. Once I got the heart transplant, which really was not that bad, I felt great and recovered pretty quickly. Dr. Watellis was ready to begin the next phase. And he had talked to me about the fact that Stanford was developing a multidisciplinary program specifically for amyloidosis.
We have been lucky enough to put a team together with specialists from every specialty you can imagine. The two biggest parts of the care right now are to try to shut off the protein production with chemotherapy and to treat the consequences of the organ dysfunction, such as congestive heart failure. The other part of the treatment, if we're talking about AL amyloidosis, is bone marrow transplant. After his bone marrow transplant, as frequently happens, he still needed chemotherapy afterwards and has remained on chemotherapy largely to this day. It doesn't cure the disease, but it can manage it in a way that just wasn't possible a decade ago. To look at him today, 5 years later, see him thriving, working, feeling well, and knowing that without that therapy, he would have died years ago is just tremendous.
Of my many goals that I had after surviving this was that I wanted to be a grandfather. And the first grandchild should be here in about 2 weeks. So it's very exciting.